Combinations of antiretrovirals create multiple obstacles to HIV replication to keep the number of offspring low and reduce the possibility of a superior mutation. If a mutation that conveys resistance to one of the drugs being taken arises, the other drugs continue to suppress reproduction of that mutation. With rare exceptions, no individual antiretroviral drug has been demonstrated to suppress an HIV infection for long. These agents must be taken in combinations in order to have a lasting effect. As a result, the standard of care is to use combinations of antiretroviral drugs. Combinations usually consist of 3 drugs from at least 2 different classes. This 3-drug combination is commonly known as a triple cocktail or HART, as we have already said. The choice of drug used is a very individualized process, based on medical opinion and whichever particular drugs a person's virus is sensitive to. Entry inhibitors, or fusion inhibitors, interfere with binding, fusion and entry of HIV-1 to the host cell by blocking one of several targets. Nucleoside reverse transcriptase inhibitors, NRT, and nucleotide reverse transcriptase inhibitors, NTRTI, are nucleoside and nucleotide analogues which inhibit reverse transcription. HIV is an RNA and hence unable to become integrated into the DNA in the nucleus of the human cell. It must be reverse transcribed into DNA. Since the conversion of RNA to DNA is not done in the mammalian cell, it is performed by a viral protein which makes it a selective target for inhibition. Non-nucleoside reverse transcriptase inhibitors, NNRTI, inhibit reverse transcriptase by binding to an allosteric site of the enzyme. NNRTIs act as non-competitive inhibitors of reverse transcriptase. NNRTIs affect the handling of substrate, nucleotides, by reverse transcriptase by binding near the active site. NNRTIs can be further classified into first-generation and second-generation NNRTIs. Integrase inhibitors, also known as integrase nuclear strand transfer inhibitors or INSTIS, inhibit the viral enzyme integrase, which is responsible for integration of viral DNA into the DNA of the infected cell. Protease inhibitors block the viral protease enzyme necessary to produce mature virions upon budding from the host membrane. Particularly, these drugs prevent the cleavage of GAG and GAG/Pol precursor proteins. Virus particles produced in the presence of protease inhibitors are defective and mostly non-infectious. Resistance to some protease inhibitors is high. Second-generation drugs have been developed that are effective against otherwise resistant HIV variants. In recent years, drug companies have worked together to combine these complex regimens into simpler formulas, termed fixed-dose combinations. For instance, there are now several options that combine 3 drugs into one pill taken once daily. This greatly increases the ease with which they can be taken, which in turn increases the consistency with which medication is taken and thus their effectiveness over the long term. Not taking antiretrovirals regularly is a cause of resistance development in people who have started taking them previously. Patients who take medications regularly can stay on one regimen without developing resistance. This greatly increases life expectancy and leaves more drugs available to the individual should the need arise.